Hello everyone and welcome to our Shishu Care channel. So now as we all know that PDCET exam for the 2025 session is on 23rd of the Feb, and about 1.5 month is left for this exam, and all the students who are willing to do secondary DNB, that is after their diploma pediatrics, they want to pursue DNB pediatrics, they are preparing for this exam. And as we have already discussed earlier in many videos that you guys get very less time for preparation because most of you guys are already doing job and are busy somewhere. So just trying to help you a little bit, and I'm starting this revision series on my YouTube channel. Just revision of few of the important MCQs or important points or tables related to the pediatric subject. Okay, so just go through this fast, and I will try to upload more and more videos in the coming days, so that before your exam you can go through these important points just for the revision purpose. And how to prepare for PDCET exam we have already discussed in our previous videos. You can go through the playlist on my channel, the PDCET playlist. There are about 9-10 videos, and few of them are about how to prepare for this exam and the pattern of this exam. Okay, so let's begin with this. So we will revise by question answer mode only, and then few theory points about that particular question or that particular topic. Okay, so the question 1, premature closure of sagittal suture is seen in dolichocephaly, scapocephaly, both or none. So premature closure, that is craniosynostosis, and of which suture? Sagittal suture. So sagittal suture premature closure is seen in both dolichocephaly and scapocephaly. So now here the different types of synostosis, and what is the shape and what are the clinical features, and few images about them. So first is sagittal synostosis, premature fusion of sagittal sutures, and the shape is scapocephaly or boat shaped head, and these are the few clinical features. You can go through them. Next is metopic synostosis, also known as trigonocephaly, the shape is triangle shaped head. Then unicoronal synostosis, frontal, known as frontal plagiocephaly, obligate front and trapezium shaped head. So these next are not that important for sagittal synostosis, metopic, unicoronal. Okay, so go through this table once. Now important, this is the summary, that skull shape and which sutures are fused prematurely. So if sagittal sutures are fused, then it gives scapocephaly skull. Again sagittal suture for dolichocephaly. So this was our question. And unicoronal suture, plagiocephaly, bicoronal, brachycephaly, metopic, trigonocephaly, coronal plus sphinofrontal and frontoethmoidal, then oxy or turicephaly. So the previous slide table is not that important, but you should remember this important table because question can be directly asked that which type of skull shape has premature fusion of which type of suture. So go through this table, this is important. Now next question, average waist to casein ratio in breast milk. So question about breast milk and about ratio of waist to casein. So answer is D, that is 60:40. So waist to casein ratio is 60:40 in breast milk. Okay, so waist to casein ratio for breast milk is 60:40, and for cow milk it's 20:80. So WC 60:40 for breast milk and WC 20:80 for cow milk. Now about some difference of these nutritive values in cow milk, buffalo milk and human milk for each 100 ml. So protein is 3.2, 6.5 and 1.1 in human. Fat is 4.1, 4.3, that's maximum in buffalo, and 3.4 in human. Lactose is maximum in human milk, so it's very sweet. Calcium is 120, 210 milligram and 28 milligram in human milk, so calcium level is low. And energy is maximum in buffalo milk, and then cow milk and human milk have almost similar amount of energy. So this is also important. Go through this table. Now para-aminobenzoic acid of breast milk prevents infection of. This question has been asked previously in any exam few years back. So para-aminobenzoic acid of breast milk prevents infection of giardiasis, E. coli, malaria or H. pylori. So the answer is C, that is malaria. So directly remember this question, this can get repeat in your exam also. Now which of the following is a mismatch? So this question is about the chromosomal bending technique. So Q bending, quinacrine, C bending, sodium hydroxide, and R bending, acridine orange, or none of the above. So answer is B, that is C bending, sodium hydroxide. This is mismatch. So just remember that this reagent used for Q bending is quinacrine. So Q for Q, this is easy to remember. For R bending, it's acridine orange, and for C bending, it's barium hydroxide. So this option was wrong, sodium hydroxide was given, so answer will be B here. Remember the reagents for this chromosomal bending technique. Now a small case based question. A 15-day neonate presented with skin changes as shown in image with focal seizures. Septic screen, sugar levels, CSF picture and metabolic panel was normal. What is the pattern of inheritance of this disease as per your clinical diagnosis? And this is the image which is showing the skin condition of a 15-day neonate. Okay, so you so the answer for this is Incontinentia pigmenti, and pattern of inheritance that for this is X-linked. So the question is a bit wrong, I'm sorry for this, but for this clinical scenario the answer is Incontinentia pigmenti and it's X-linked disease. Okay, so the major criteria of Incontinentia pigmenti: typical skin manifestation distributed along the Blaschko's lines. So there are 4 stages: stage 1, 2, 3, 4. First is vesicobulous stage, second is varicose stage, third is hyperpigmented stage, and fourth is atrophic or hypopigmented stage. And the minor criteria, what are other abnormalities we can see? So ocular, CNS abnormalities, dental abnormalities, alopecia, abnormal hair and palate abnormalities, abnormal nails, nipple and breast anomalies, multiple male miscarriages, typical skin pathological findings. So these are major and minor criteria. So what was given in the question? Skin changes obviously through Blaschko lines. Focal seizures means CNS involvement. Septic screen, sugar level, CSF picture and metabolic panel all was normal. So the cause of seizure because of and the skin involvement. So among all these the answer will be most appropriate is Incontinentia pigmenti. And these are the few criteria. Question can be asked about the stages, that which stage has hyperpigmented stage in Incontinentia pigmenti. So stage 3. So go through this table, and image based question can be asked, so remember this images. Okay, now next is chromosome involved in Charcot-Marie-Tooth disease. So which chromosome is involved? Chromosome number 1 is involved in CMT. Remember this one. So common association with chromosome 1, few of the common associations of chromosome 1 are CMT, Rh system, neuroblastoma and NPHS2. So these are the few common associations of chromosome number 1. Now few points about Charcot-Marie-Tooth disease. Is a most common inherited neuromuscular disorder characterized by progressive weakness of the extremities due to peripheral nerve damage. So most common peripheral nerve damage, common inherited disorder for peripheral nerve damage. The disease primarily affects the lower limbs, leading to foot deformity, sensory loss and muscle weakness. Symptoms typically appear in the first or second decade of life, and occasionally CMT also involves the cranial nerves, other areas of the neuraxis and various organ system. Okay, so points to remember: most common inherited neuromuscular disorder, that is most common peripheral nerve or peripheral neuropathy, inherited peripheral neuropathy, and it affects predominantly the peripheral nerves of the lower limb, and that leads to deformities of foot, sensory loss and muscle weakness. And the time of appearance of symptoms is around first or second decade, and occasionally it may also involve cranial nerves and other organ systems. So now enzyme, question 7. Enzyme replacement therapy is available for all except. So always in your exams you should remember, you should read this properly, all except word. The Gaucher disease, Pompe's disease, Fabry disease, and available for all of the above. So this enzyme replacement therapy is available for all of the above options. Okay, so enzyme replacement therapy is available for Gaucher's, Pompe's, Fabry's, mucopolysaccharidosis type 1 and 2. Now table for glycogen storage disease. So go through this table from any of your book, and I have given just here for a quick idea. So type 1 von Jurgen's disease, enzyme deficiency is G6 phosphatase, and organ affected are liver, kidney, severe hepatomegaly, severe hypoglycemia, lactic acidosis, ketosis, hyperuricemia. Type 2 is Pompe's, alpha 1 4 glucosidase or acid maltase deficiency, all organs are involved, death from cardiac failure in infants. So from this table many clinical based questions can be formed. Okay, the third is Cori disease, and remember CD. Okay, C Cori disease and deficiency of enzyme is debranching enzyme. Muscle and liver are involved like type 1 but much milder, so this is milder. Type 4 is Anderson. For this remember AB, that is Anderson for branching enzyme, and liver and myocardium are involved, death from liver cirrhosis usually before age of 2 years. Fifth is myocardial disease, and muscle phosphorylase deficiency is seen in myocardial disease. So most common organ affected is muscle cramps and pain on exertion, easy fatigability, but the life expectancy is normal. Sixth is Hirsch's disease, phosphorylase deficiency, and liver is affected like type 1 only but milder with less severe hypoglycemia. Hypoglycemia will be there as liver is affected. Seventh is Story disease, so phosphofructokinase deficiency, muscle and RBCs are involved. And then eighth one is phosphorylase kinase deficiency, liver is involved. So the initial few up to 5 are quite important. Now next question, which of the following is subperiosteal? Among these following conditions, which of the following is subperiosteal? So caput succedaneum, Keffel hematoma, or subgaleal hemorrhage. So Keffel hematoma is subperiosteal. Now the difference between these three, caput, Keffel hematoma and subgaleal hemorrhage. Location of caput is subcutaneous and extraperiosteal. Keffel hematoma is subperiosteal and it occurs in 2.5% of all live births, and subgaleal hemorrhage is under aponeurosis. Now extent seen in these three conditions. So caput, it crosses suture line. Keffel hematoma is confined by suture lines, and subgaleal hemorrhage extends in subgaleal space from orbital ridge to nape of neck. And the complications of these three, caput, it resolves by a week or two. It's very commonly seen in babies, so it resolves by a week or two. Keffel hematoma, it takes 8 to 12 weeks to resolve, and subgaleal hemorrhage may lead to some severe conditions like jaundice, blood loss, shock, and mortality. So these are the major differences between these three conditions. Important one, many times they ask questions. So next is most common heart disease in infant of diabetic mother. So among these options you may get confused, but the answer is TGA, that is transposition of great arteries. So if it is asked that most common heart disease in infant of diabetic mother, then it is TGA. Now most common type of tracheoesophageal fistula, and it's type C. So how many types? 5 types are there commonly. Type A is isolated esophageal atresia. So here only esophageal atresia is there, while no fistula is there. In type B, atresia with proximal fistula. So atresia is there and also proximal fistula is there. Type C is atresia with distal fistula. So atresia of esophagus plus this distal fistula is seen. Type D is atresia with double fistula. So atresia is also there, and proximal as well as distal fistula is there. So this is type D. And type E is isolated fistula. It's also known as H type, as this H figure is appearance is there. So no atresia of esophagus is normal, but this anastomosis fistula is present. So this is type E or H type. So these were 10 questions for today's session, and I will try to bring more and more lectures and more important points for you guys before this PDCET exam. And for more such videos, you can subscribe this channel so that you can get notifications in near future, and try to share with your friends and colleagues. And I hope you all have already started preparing for this PDCET exam. This 23rd Feb is not too far now, and even if you start from tomorrow, then also you can achieve a very nice rank in this exam, because competition is not that much and you have to read sincerely only for few weeks or months to get a good rank, as you already have good knowledge of the subject, as you have already passed your diploma exams. And how to read in brief, if we will discuss, then you can go through any app for NEET PG and go through the pediatric section of that app, or you can purchase any MCQ book which NEET PG guys are following, and you can go through the previous year questions of NEET PG and INI exams. So no any special book is available for PDCET in market which covers the previous year questions. Many of you are asking this, but previous year questions are not available in market. So for PDCET exam previous year questions of NEET PG and AIMS PGI, or nowadays it's known as INI. So only those questions are very much important. And you can also go through your standard textbook Nelson, but it's not possible to cover all the 3 volumes. It's very vast and it's not possible to remember. So I will also try to cover a few tables of Nelson's if possible for me and if time permits. But these 2 things are important. Either you go through any app or you can purchase any good MCQ book for NEET PG and go through that. Try to revise at least once before this exam. So thank you very much and all the best for your preparation in coming days.